Armen Henderson is on the call. Armen, are you there?
Yes, I am. Can you hear me?
Absolutely. Thank you for joining us. We're happy that you're able to get on today. You are coming towards the last third of our conversation. We've had some great dialogue around, we spent some time talking about what's going well in the community around homelessness, and there's been some wonderful examples, and we've sort of moved into the impact of COVID to homelessness. And perhaps that's a good place for you to sort of jump in and bring your voice in, because I know you have specifically been sort of working on homelessness in the Miami area, the city of Miami in particular, and looking at the impact that COVID has had on that community. So do you want to talk a little bit about the work that you've been doing and what you've been observing?
Yeah, so first of all, I want to say that thank you for having me on the call. I apologize for being late. I thought the time was later than what it was, so I'm sorry. With that said, I do want to say that this is a very important conversation, that homelessness is not necessarily something that I've worked on in Miami in the past, but I have worked with vulnerable communities, which includes homeless individuals during crisis. And the pandemic has definitely presented itself as a crisis that has exacerbated every social determinant of health that really affects people's bottom line, the ability to survive in places like Miami. And so, you know, we've already had crises that were going on. There was already an economic downturn. Jobs were already very sparse. We weren't paying people livable wages, et cetera. And now with the pandemic, it pretty much made all those things worse. And so, you know, when I decided, or when I was asked to help respond to the homeless or to the unsheltered community in Miami-Dade County, I did so, but I did so with an open mind as well. I did so, you know, without any biases around who were the key players, et cetera. I just went in really just wanting to just help. And I did that, and I was met with a lot of pushback. And what I've identified is that, you know, we're in a crisis, and the pandemic is stretching people and organizations to places that they've never been before. And it does require us a response that's unlike a response that we've had in the past. And I think everyone on this call can agree that visibly in places like Overtown, more than it is in places in other places, homelessness and unsheltered individuals and evictions and things of that nature have shown up full force, and it's really out in the open now. So much so that you can't really look past it. And so I think that's the reason why, you know, OCYC wanted to call this convening, because they're seeing it firsthand. And everyone, you know, I believe that everyone has the best interest at hand for this population and to solve this problem, but it's going to require us to do something different than what we've done in the past. And that's all I've been advocating for since I've been on the front line, not only, you know, seeing these individuals in the community, but also in the hospital as well. And so, you know, I'm here to dialogue, and I'm glad that we're having this call, and I'm hoping that people, you know, get creative around solving this problem. The things that we did in the past may not necessarily work, and we should be trying something new. And on January 1st, it's only going to get significantly worse, with Florida being probably one of the #1 places in which evictions are going to increase exponentially, especially in Miami. And so, you know, I'm looking forward to working together and to seeing what solutions we can come up with.
Well, we're happy to have you on the call.